Most estimates seem to say that we're a week to 10 days away from the peak of the virus. Does the NHS have enough capacity to deal with that peak?
I think that indeed we are just that a week away from the surge of this. We've been preparing really hard to manage that surge and to manage that real increase in demand. We are already seeing hospitals and other types of healthcare providers really facing the pressure on this, but I think so far they are managing okay. But I think the things that we need to remember are that we need to really focus on protective equipment, we really need to focus on testing, and we really need to focus on ventilator capacity. So if we just take protective equipment, because that's been such a highlight of the conversations that we've heard about the health service over the last week to 2 weeks, and this real lack of confidence of frontline staff and also hospital and other health service chief executives about whether they are adequate and whether we've got the supply. And I think that the changing guidance that we saw earlier this week should really give us that confidence, and we are hoping that it does give us that confidence. But what that needs to be backed up with is the confidence of supply, and I'm not sure we're there yet. We've seen really huge transformation in the supply chain. If you cast back 4 weeks or so, there was a 500% increase over a 72-hour period for demand for all of this protective equipment. We know it's getting better. We hear far less from our trust chief executives about shortages, but those shortages are still there. Right now, we know there's a real shortage of gowns, there's a shortage of visors. So we need to see that turned around as quickly as possible. But I have to pay tribute both to staff on the front line, trust chief executives, and also those who are working with the centre to manage the supply chain, because they've done something immense over the last few weeks to try and get a system in place that will work. But this is unprecedented demand. So, we are really grappling with real-time changes. So that's the protective equipment, and it's absolutely critical that we sort that out and give confidence of supply as well as confidence in the level of protection.
So some improvements, but more to be done in other areas as well. Testing is another thing, of course, that's been really focused on too. Matt Hancock saying that they want to ramp up to 100,000 tests a day, but of course we're only around 10,000 now. Yep. Is it doable, do you think, to increase capacity so much?
Over time, this may be doable, but I think what we've got to be clear about is that the government needs to talk really closely and work really closely with the front line in delivering this ramp up of testing. So at the moment, we're talking about 100,000 a day by the end of April. At the moment, we're probably somewhere around 13,000 a day. Trusts on the front line really want to play their part in this, and they can play their part in this. We're not yet clear if the supply of raw materials such as swabs and the reagents that's needed is going to be as smooth as we would like it to be. But the critical point around testing is the fact that this is about vacancies on the front line. The more staff we test, the more staff we can get back to work, because obviously we have staff who are self-isolating at the moment because they're in households where someone else is unwell, possibly with coronavirus, or possibly with something else. But we really need to get staff back to work, because without that, then we can't run the health service effectively. And if I can just make one point, this isn't just about hospital staff. This is about staff out in the community doing home visits. This is about mental health trust staff who are supporting people in an inpatient setting. So it's all types of staff, and our paramedics as well. So this is really about ramping up that testing.
Now, you also mentioned ventilators in your first answer as well. My question to you as well is, how worried are you about any regional disparity? Because we know that there's been peaks occurring at different stages around the country. London, the West Midlands, for example, hit much worse. Are you concerned that some NHS trusts may be better prepared than others in dealing with what is to come?
Well, we know that the stock of ventilators is being managed nationally. So that's really important to remember. So the supply will come through national routes. I think that the nature of this pandemic is that it has is spreading from region to region. London is probably best prepared because London has seen the kind of surge in demand hitting first, but it's absolutely critical that we make sure that every part of the country is supported.
Okay.
The massive transformation that we are seeing in our usual hospital services to set up their own mini-Nightingales on their patch is absolutely astonishing. And I think the one way that the country could pay tribute to all of the work that has been done is to stay at home indoors in this really sunny weather, so that
And on that point
Correct.
about staying indoors in the sunny weather, what would you say to people? What's your message to those who may be tempted to break the lockdown?
So our chief executive, Chris Hopson, put it really well yesterday when he said it's one thing to stand outside your front door and clap for the NHS health and care staff. Please carry on doing that. It's immensely motivating. But the biggest step you could take would be to make sure that you stay at home, because we need to stop the spread of the virus. We can treat people, but surely it's better to stop people getting it in the first place.